Hi, my name is Dr. Jane Hendricks, and I want to speak a few minutes about hair loss. A lot of people, when they reach around 40s, 50s, both men and women, they start experiencing more hair loss. It's normal to shed hair throughout our lives, but in some cases, we start losing more hair than we're growing back. And this can be due to some hormonal imbalances. A couple things that you'd want to check is thyroid, for one thing, just because it's such an important hormone, not just for hair, but for energy. If you're hypothyroid, you might be feeling a little depressed because it causes hypothyroidism can cause depression, also weight gain. So there's a number of big symptoms that go with hypothyroid. So that would be one of the first things you'd want to check, and not the two markers that your primary care checks. It would be the full thyroid panel. Naturopathic doctors, I always test for the full panel with every patient, because that includes the active thyroid, not just the inactive. So it's important to get all of that checked. Testosterone, both in men, especially women, when they start reaching perimenopause or menopause, can start converting to the negative form of testosterone, which causes hair loss in the head and hair growth on the face. So that's a good test to check for the conversion. There's a enzyme 5-alpha reductase that you'd want to get checked to see if that's being overactive. Naturopathically, there's ways to treat that. It can be as simple, maybe it's not hormonal, it can be as simple as decreased hydrochloric acid in our stomach, because as we age, we do have more aging organs as well. That includes the digestive system. So sluggish pancreas, sluggish small intestinal enzymes, and the stomach for the hydrochloric acid. When you're not absorbing your minerals, the hair relies on trace minerals, essential fatty acids. So when you have malabsorption, and then that turns into malnourishment. So even if you're eating a healthy diet, if you don't have you're not absorbing those critical nutrients for hair, then you'll start experiencing hair loss. So that's a given for everyone as we age, really, to start taking extra supplements to compensate for the poor absorption of nutrients. And that's a lot of people, we don't think about that. Like when you go to a dermatologist or you go to your doctor, they're not even thinking about this malabsorption issue. So as a naturopath, that's the first thing that we address, is getting your nourishment up in your body. And then, of course, we're going to check your hormones, various hormones. And then there's just the plain shampoo. There's a Monat shampoo I find has been very helpful in growing hair and just making it so healthy. There's different lines that you can choose from depending on the type of hair that you already have. So I would contact someone that's working with that line. I'm working with that line, so I kind of guide my patients on, get this one, not that one, because that is important to choose the right products with the Monat hairline. So that's the local way to address hair growth, is through shampoo and conditioner. That can be very powerful. It has been for me, for sure. And along with taking what you need to internally and balancing your hormones. So for more information, click on my blog or feel free to call my office if you have any questions.